Uh, Hello everyone, and welcome to this audio podcast. This audio podcast, this audio podcast, as part of a quantum edition. This audio podcast is part of a Labostix sequence. This audio podcast is part of Vortex Gauntlet. This audio podcast as part of the abstracts, and this audio podcast as part of a Storm Labostix production. In this audio podcast, as part of this audio podcast, as part of the abstracts, there'll be a look at sort of a part of an abstract, or part of an abstract, a part of an abstract in regard to works from 2000 between 2018 and 2021, more specifically in around 2021, and looking at education empowerment and practice excellence. And I look at this works from a practice review, a sort of practice review sort of perspective, and looking at looking at this works in line sort of aligned to linked to chronic kidney disease, electronic patient records, and also sort of online sort of portals or organizations. So a little bit in regard to the abstracts of this peer reviewed published work from 2021. So online portals have and spaces have allowed recipients with long-standing conditions or long-term conditions to access sort of information relating or regard to health and disease through a range of modalities. Information available online for recipients or patients is generally vast, but much of it can be daunting, and also sort of lead to misinformation. So patients or recipients with long-standing conditions or long-term conditions need to may require or be sort of signposted even to resources that are appropriate for requirements. Support for patients with long-standing conditions from healthcare professionals can also is and can also be multifaceted, and recipients may sort of may find sort of advantage from scheduling time with for example allied healthcare professionals, or AHPs, who can offer and provide who can provide and offer sort of remote educational services. So, for example, chronic kidney disease or CKD recipients, for example, might that sort of educational aspects on the reasoning behind blood tests and investigations helpful. And initiative would be supplementary to care or healthcare as part of electronic patient records, or EPRs. And so since around 2009, 2009, the Renal Patient Support Group, the RPSG, as sort of social media platform, has a standing sort of history of offering evidence-based educational support for recipients and patients and healthcare professionals across social media, and an established evidence-based and an established sort of evidence-based website. Online portals can improve patient patient and recipient documentation by facilitating more complete records to be kept with fewer errors alongside improving the ease and efficiency on behalf of health professionals maintaining electronic patient records. Providing documented educational material should also reduce unnecessary complexity and reduce duplication and improve collaboration between multidisciplinary teams. Telemedicine links for video consultations, imaging, and laboratory data could also enable laboratory teams to be involved in discussions with CKD recipients sort of remotely or through group consultations. Of course, any educational provided would require documenting and transfer of information. Connectivity of any future tech or links between electronic patient records would need to be general data protection, regulation compliant. In regard to the aims and objectives of this works, or part of this abstracts at least, is where the review sought to highlight whether it is or would be advantageous to involve multidisciplinary teams in online consultations and or educational sessions through the Renal Patient Support Group or our PSG website to improve educational practices and health literacy for CKD recipients. It seeks to the work sought to understand, prompt and understand if it would be helpful to have follow-up online consultations with multidisciplinary teams for healthcare following routine appointments. That draws this audio podcast to a close. This audio podcast, as part of a quantum edition. This audio podcast as part of a Labostix sequence. This audio podcast as part of a vortex gauntlet. This audio podcast as part of the abstracts, and this audio podcast as part of a Storm Labostix production.